So what's the advantage of a dental implant if you're just missing one tooth over what traditional dentistry offers?
The benefit is that you're replacing just what was lost. The one tooth was lost, we put the new tooth in. When you do traditional bridges, which I've done a ton of, the problem is you need to drill down other teeth. And you make a one-tooth problem a three-tooth problem. Now if either of the teeth next door are ever sensitive, they get periodontal disease or gum disease around them, now your bridge is no good. Then you have to move on to the next tooth. And you start to run out of teeth to bridge. So by replacing using a dental implant, you replace just the tooth that has been affected by gum disease, a cavity, etc. And you leave the teeth on either side intact.
What about pain? Seems painful.
That is a common misconception. People, I don't know why they think it's painful. I mean, I guess because it's a screw in your jawbone. It sounds extremely painful.
So the bone doesn't really have
It sounds extremely painful. But right, the bone does not have a lot of nerves in it. So they don't feel the pain deep into the nerve. And the gum tissue is the fastest healing area in the body. When you bite your cheek, well, if you don't bite it again continuously, or you have a scratch in your mouth, nothing heals quicker. You know, a paper cut in your mouth would heal within days. So the soreness that's involved from the small incision is not painful because it's done. It's done. It's 72 hours to 7 days later, it's healed.
So if somebody's missing a tooth, they could go in, get an implant. Could they get a tooth on the same day?
Yes, I get excited to do it all on the same day because I know people don't like to see me. So why would you want to come in for one surgery to get rid of a tooth and another surgery to graft and have sutures and another surgery for me to put the implant on? There's nothing that makes me happier than simply doing it all at the same time. Same day, taking out the tooth, knowing that I've cleaned the bone of infection, knowing that I'm getting something in that socket right away to stimulate bone growth, and that's the joy of the new technology in bone grafting and implants. It's there, it's asking your bone, come on in, hold on to me, instead of you trying to, down the road, you know, go back and do it. So it saves the patients a lot of time. It also has saved patients a lot of money compared to how my patients were doing it 5-10 years ago. Implants were probably twice as expensive. And it does also help just comfort-wise. They only have to have soreness for 48 hours once.
Is it true, I think you told me this, that in the long run, it's less to do it with an implant than a bridge?
Right, because bridges normally last 10 to 15 years. Even insurance helps to cover them every 7 to 10 years. So that means they're planning on it failing. So if you're going to get one bridge, plan on getting 2 or 3 over the course of the length of your life, if that's even a possibility. If a tooth gives up on you next door, then you might be getting a partial. You know, you just keep kind of flipping through different types of dental treatment that you could have been prevented by just replacing the single tooth that was gone.